Welcome to Season 4 of AIHA's podcast series, The Healthier Workplaces Show, where we explore timely and informative topics about occupational and environmental health and safety. I'm your host, Alejandro Castillo. Today, I have the pleasure of speaking with industrial hygienist, Deborah Nelson. Deborah earned her bachelor's and master's degrees in environmental science from the University of Oklahoma College of Engineering, and her master of public health and PhD in environmental health at the University of Oklahoma Health Sciences Center. She has been certified in the comprehensive practice of industrial hygiene since 1981. Deborah has served as an OSHA Industrial Hygiene Compliance Officer and a professor of environmental science at the University of Oklahoma. For 2 years, she was an occupational health scientist with the World Health Organization in Geneva, Switzerland, where she conducted exposure assessments on the global burden of the occupational injury and illness. Deborah is a fellow of the American Industrial Hygiene Association and served as president in 2017 and 2018. Today, Deborah is the project chair for AIHA's Grand Challenges leadership team and the facilitator for the Promoting Health Equity team. In this episode, we're going to learn more about AIHA's Grand Challenges for worker health, safety, and well-being, and how they will improve workplace safety in the years ahead. Deborah, thank you so much for joining us today.
Thank you, Alejandro, for inviting me. I'm always really glad to talk about the Grand Challenges for worker health, safety, and well-being.
Let's get started. So, outside of the context of the occupational and environmental health and safety profession, what are the grand challenges?
I think the best example that most people would be familiar with is when President John Kennedy back in 1961 issued this challenge to Congress of putting a man on the moon and bringing him back safely within the next decade. And of course, you were either there glued to the TV or you remember from your history that did in fact happen. So when we started out to do the grand challenges for worker health, safety, and well-being, the kinds of things we looked at were big and important, compelling initiatives that if we could address these, that would really make a difference in people's health and their safety and their work lives. And they are initiatives that are solvable. We're not trying to issue any impossible challenges here, the impossible dream, but progress could be made in the next 5 to 10 years, that there would be measurable outcomes. They would require interdisciplinary cooperation, innovation, and it really is going to require a long-term commitment. Of course, the grandest challenge for us would be to eliminate occupational injuries, illnesses, and fatalities. I think it's important to think of these grand challenges as being focused on the workers and the workplace, and not specifically on our profession or our association, as big a part of my life as those things have been. But the focus of the grand challenges for worker health and safety and well-being have been specifically on the workers and where they work and the communities that they live in. It really goes beyond any strategic planning that AIHA has ever done, or environmental scans, or the NORA, the National Occupational Research Agenda. We're trying to take a 50,000-foot view here, and we know that it's going to require other partners, other organizations and associations, other disciplines, other professions. But we really thought that AIHA was the ideal place to start an effort like this.
Absolutely. Now, in 2022, AIHA conducted focus groups of volunteers and a survey of the entire membership to identify 4 grand challenges for worker health, safety, and well-being. Tell me more about these grand challenges. What are they?
Okay, first I'd like to say that the different associations that have done grand challenges have all done them in a different way. The engineers started with their deans and academics. The medical people started, with the doctors. The social workers really made a wide effort to involve all their membership, and that was the model that we followed. So we did those focus groups. Of course, we didn't have a huge budget, but we tried to contact as many committees, groups, the International Affairs Group, et cetera, to get as much input as we could. And then we had a professional survey done to find out if our membership agreed with the specific topic areas that we thought were important. And we had come up with 4 that really to us seemed to capture the essence, and they were the impact of climate change on worker health, safety, and well-being, the increasing challenges of the changing workplace, the problems or the challenges we continue to have with exposure assessment, and the fourth one, which is the one that I worked the most closely with, was to reduce occupational health inequities and reduce workplace precarity issues.
And what is the overall timeline for addressing these issues?
Well, that's an interesting question, Alejandro. The first phase of the project was to delineate what these challenges were. And it took us some years to do this. We had an excellent team. We had strong support from AIHA staff and from the board of directors and from all the presidents that were in place through this time. So it took us until sometime this winter to get these grand challenges delineated and to propose them to the board, and the board approved all of them. In terms of the next phase, which would be working with different associations, organizations, institutes, it's going to vary depending on the challenge itself. It's really an open-ended question as to how long it'll be before these issues get solved. The specific report that's available now for people to access through the website by asking for a download of it is the climate change. So specifically, that's going to involve direct impacts from climate change, such as heat and ultraviolet exposure and ozone. But it's also going to involve indirect impacts, such as psychosocial. People, as they lose jobs or have difficulty finding the same food, they may have to move, they may lose a home because of a natural disaster, a lot of psychosocial impact. And then there's the impact of vector-borne diseases, increased rates of malaria further north, for example. And then there are the spin-offs, the new technologies such as battery manufacture, offshore wind technology. These are going to pose new and as many as yet unforeseen issues in impacting worker health, safety, and well-being. So the kinds of solutions are really open-ended. The group that worked specifically on that topic talked a lot about global consensus on regulations and standards, on multi-sectoral responses, on education and research and development. The group that I worked in specifically was the occupational health inequities, and that's related to the fact that you can have a whole group of people, expose them to the same workplace conditions, and have varying rates of health and well-being impacts from that. So to start to go back and address those varying impacts, we believe is really going to be based in the community, because so many people come to work with pre-existing chronic conditions. So improving the kind of conditions people have in their communities, the availability of healthcare, education, jobs, nutrition, transportation, education, all those things. One of the best solutions that has been proposed, or that's actually been shown to work, is one that we discovered through the Surgeon General's report in 2021 called Community Health and Economic Prosperity. They had located approximately 40 situations in which an organization, a business, a local group, in one case, a local Native American tribe in Oklahoma, had realized that community conditions were impacting their ability to find qualified workers and keep them on the job. So in every one of these situations, the organization or the company partnered with the community, including civic groups, local financial institutions, academics, healthcare institutions, a variety of groups like that, to develop solutions. So for example, in one case, the company was having trouble getting workers, employees who could pass the drug test. So they worked with healthcare groups and other social work institutions to try to address that issue. But at the same time, they gave these people employment on a temporary basis. So that worked out to be very positive. Second example is up in Ohio, there was a community that really had no grocery stores in the area of the workers. It was a food desert. So the community worked together to actually start their own version of, to me, the Whole Foods model, where you have safe and healthy and wholesome foods. You have facilities there for education on nutrition and childcare, that sort of thing. So that's been something the community's really proud of.
That's great to hear.
Yeah. I'm really proud of is one of the Indian nations in South Central Oklahoma realized that people couldn't apply for jobs, they couldn't get advanced education because there was no broadband internet. So they worked with various groups within the state government of Oklahoma, as well as financial institutions, to put in some broadband internet cable that brought that kind of service to 13 counties in South Central Oklahoma that did not have that. So there are a number of examples out there of how this approach of developing partnerships with the community can really benefit not only the employer and the employees, but also other members of the community.
Absolutely. So we established a challenge, potential solution. How will AIHA measure the impact?
Well, ideally, we would see, and of course, this is a lagging indicator, a reduction in injuries and illnesses and improvements in well-being. But once again, the specific metric is going to depend on the specific challenge. So let's take a look back at the climate change. If we can educate workers and employees and develop better solutions to protect people from exposure, for example, to ultraviolet radiation, we should see a reduction in the rates of skin cancer. More indirect example may be if we can get the climate change under control, fewer wildfires, there will be fewer firefighters exposed to the gases, the particulates that come off fires, and we should see lower rates of cancer in firefighters. So again, it goes back to that specific challenge.
So you think you can communicate? Submit a short self-recorded video highlighting your OEHS story. Participate for the chance to win a $250 gift card. Entries are due by August 24th, 2025.
Are there any tools or resources provided by AIHA currently that can be used?
Well, I would refer people back to the report that's now available through the website. You can enter your name and email address, and they will send that to you. And read that specifically, because there are really good examples in there of the kind of things that can be done. But once again, it's going to take the collaboration, the partnership, the innovation to make these things happen. And I truly believe that with the skill set, the experience, the knowledge that industrial hygiene and environmental safety people have, that we're the right people to start to build these partnerships and collaborations.
This May, AIHA released the 2025 Grand Challenges Introduction and Executive Summary and the first of 4 Grand Challenges concept papers, mitigating the impacts of a changing climate on workers. Tell me all about that.
After we figured out what our 4 topics were going to be, we issued an open call for people to join the committees, the task groups. And we had great participation. We ended up with something like 24 highly qualified members of AIHA, younger members, newer members, and what we call the luminary members, people with gray hair who've been doing this for a long time. And they did incredible work. They researched and talked and wrote and rewrote, and we reviewed each other's papers and rewrote again. In general, they followed a basic outline that first discussed the challenge, the nature and the extent. They were analyzing what that specific challenge was. And then they proposed some preventive actions. Now, of course, it's not limited to that. That's just an idea to get people thinking. They thought about metrics. Again, many of these might be lagging indicators in terms of improved health and safety statistics, but then there also might be leading metrics, such as the number of communities that are getting involved, or partnerships being formed, or webinars taught, or people being engaged at a community level in these kinds of issues. Each of the papers would discuss possibilities for interdisciplinary collaboration and what the next steps might be, and closing with a call for the members of our profession is to, what is it that we can do to take this effort forward. Again, the papers all got reviewed and discussed and rewritten, and then they were approved by the board of directors, for which we were very pleased and proud about that. They are now, the climate change paper has been reviewed and lightly edited, and for style and consistency, because we all tend to speak a little bit different languages in this. And the next 3 are undergoing that process and will be posted and available as soon as they complete that process.
How exciting.
It is for us. Now, the next step is to start to socialize these papers, to get the information out there, whether that's, I think a series of articles in the Synergist might be next, reaching out to partners. For example, in the climate change area, there's a group called the Health Action Alliance, and they're, again, a broad consensus of people concerned about this, business professionals and so forth. There is a subcommittee on that group called the National Commission on Climate and Workforce Health. Our CEO of AIHA, Larry Sloan, is a co-chair of that group, along with David Michaels, who is a name well known to people in our profession. There are other groups out there that, as appropriate, will be contacting and engaging them to partner with us or joining activities that they already have in place. We, for example, the area that I worked most closely in, the occupational health inequities, for example, we might reach out to the American Public Health Association, because they also have a strong occupational health committee as a part of their association. So again, it's going to depend on each one, and a lot of work left to be done, a lot of opportunities out there.
Well, I'm very excited to read each paper as it comes out. For me, it feels a bit kind of like a movie series where part 1's out, part 2, and it's just, we're excited to get to the finale,
Yes. And of course, the executive summary of each one is available. So you can also receive that summary and get a picture of what the overall project looks like.
Perfect. Now, going back to a little bit about the climate paper, was there any particular insight you can share with us that you found outstanding or informative?
What was really new information, new learning for me, was the idea of all these kind of new and emerging safety, health, and well-being hazards, such as the alternative energy sources, battery manufacturing, offshore turbines, the idea of it very much like going out to an offshore oil drilling rig, the isolation, separation from the family, the being out in the middle of the ocean, a number of different kinds of hazards coming out of the spin-off technologies that I hadn't thought about. And kind of a rabbit hole from that, a tangent from that, is that the nature of fires is changing because of the kinds of materials that are going into the batteries. For example, lithium is commonly now found as in people's homes or in areas around a fire where cars with electric batteries, the electric vehicles, have been burned. So all kinds of spin-offs and tangents coming off of this that there's still so much to learn about and to consider in terms of not only the health, safety, and well-being of the workers, but also the community.
Now, we did touch a little bit on the focus groups. I want to go back to that a little bit. If somebody's interested in volunteering or joining the focus group, how can someone join?
Well, the focus groups themselves, that work has been completed, and we use that work to help ensure and to develop the grand challenges themselves. But if people will go to the AIHA website under the Get Involved tab and then scroll down to Grand Challenges, there's a place where you can sign up if you want to get more involved in one of these projects. For example, you may know a lot about the new technologies in the changing workplace, such as the impact of artificial intelligence on a worker. Then you may want to sign up specifically for that group, or you may know of a group that's working on that issue. So we want your input, not only to have you join one of these teams, but you may be able to share information about other people that are working in that particular area.
The more insight, the better, of course.
Exactly. We all come to the table with a different skill set and knowledge set and toolbox. So that's why we issued the open call for AIHA members to participate on these teams. And in a few cases, we had people who were experts, for example, on climate change, also participated who were not AIHA members. And of course, going forward, we'd like to get as many people involved as possible, both within and outside of AIHA.
Expand your IH fundamental skill set with hands-on training in chemical monitoring. AIHA, University's Exposure in Chemical Monitoring. Beyond IH Fundamentals, road course will be taking place October 20th to 22nd in Westerville, Ohio. Don't miss out. Register today.
Now, as a facilitator for Promoting Health Equity Team and a former AIHA president, how has this project influenced your view of the OHS profession in the future?
Well, I have to confess, I started this whole project as a student of total worker health. And of course, that opened my thinking up to the impact not only of what happens in the workplace, but what happens in the larger community. My thinking has really expanded beyond the four walls of the places where people work to really think more deeply about the role of the community and the community conditions in impacting people's health. A large percentage of people, something like 60% of us, go to work, people over age 20, go to work with some chronic health condition. And a lot of those will never get solved in the workplace or by the employer. So many of those conditions come from the community itself, the wider community. So what the Surgeon General calls as the 7 vital conditions, it includes things like basic safety and health, having an adequate diet, parks and recreation spaces, good transportation, good air quality, good water quality, civic belonging and engagement. All of those kinds of issues have a major impact on people's their health status. As important as we know the workplace is, the community also has a major impact. So until we start to address those kinds of issues, we're never going to completely solve the issues of worker health, safety, and well-being. So my thinking, or the impact that it's had on me, is to think of the industrial hygiene, the OEHS professional, as a member of the community, and perhaps someone who can act as a change agent, as a collaborator, a networker, to start to get all these people engaged, working together, because I think that's what it's going to take to truly impact worker health, safety, and well-being. We've taken it very far, especially with workplace fatalities. You've watched the OSHA fatality statistics drop down year after year after year until they kind of bottomed out a few years ago. We've not seen that same thing happen with occupational illnesses. So we still have a lot of work to be done. And I think a lot of that involves the community and the health conditions in that community as well.
Absolutely. I think in order to have a healthy workplace, we as a community have to work together to solve it.
We do. And I can hear some people now saying, my job's in the building, it's the four walls, I don't want to get involved in that, and that's fine. But I do think that enough of us have to get involved to start to make a difference, to see a change.
Change is needed.
Change is needed.
So in May 2018, the first idea of the Grand Challenges was proposed by you. Now we're in 2025. If you can go back to the past and talk to yourself and get advice about what to do or what to prepare for, what would you tell yourself?
That's a really good question. I think that the key to the process is getting the right folks involved. And I think we got really lucky to have the team members that we have, the senior leadership that came to help. Chris Lasses Davis, Denise Deeds, Don Weeks, and Tom Grumbles. They're just an outstanding team. So I would say collaboration, teamwork. And then my job at that point was helping people get what they needed. I think that at the same time you've got your eye on the big picture, it's also important to keep an eye on the management of the small details. And I think I could have done a better job managing some of the details. But again, it was teamwork. Outstanding crew of about 24 people.
Where can people go if they'd like to learn more about the Grand Challenges Project?
I invite anyone who's interested in the Grand Challenges Project to go to the AIHA website, click under Get Involved, and then scroll down to Grand Challenges. And you'll have an opportunity to request copies of the executive summary and currently the climate change paper. Soon, at some undetermined date, you'll have an opportunity to also look at the papers for the changing workplace, for exposure assessment, and occupational health equities. Further down, don't forget to keep scrolling on down, you'll see opportunities to volunteer or to provide suggestions for entities, organizations, people that might also be interested and want to get involved in the project.
Deborah, thank you so much for joining us today. That wraps up today's episode of the AIHA Healthy Workplaces Show. To learn more about the Grand Challenges Project and read the Grand Challenges concept paper on climate change, visit the AIHA website or click the link in the description below. Listeners, thank you for tuning in, and as always, remember that healthier workplaces mean a healthier world. Until next time.